Hello friends, I am Dr. Sanket Shah, consultant hematologist and bone marrow transplant physician at Hemato Oncology Clinic, Ahmedabad. Today what we are going to discuss is about bone marrow transplant. I am trying to explain what is bone marrow transplant in the simple language as possible. You might have heard so many words like bone marrow transplant and stem cell transplant and also. So what is this bone marrow transplant or what is this stem cell transplant? Are they different? No. Basically stem cell transplant and bone marrow transplant are the same thing. To understand this, we need to understand first what is bone marrow or what is the stem cell. A stem cell is basically a cell in our body that can replicate as well as that is able to produce all kinds of blood cells in our body. So all WBC, RBCs, platelets and all lymphocytes and immune cells are basically produced from a single stem cell. There are plenty of stem cells resides in our body and they resides in the bone marrow. So when we transfuse these stem cells or this bone marrow to the other patient, it is termed as a bone marrow transplant or stem cell transplant. Now, as you know, when a kidney transplant we say the kidney from one patient is transferred to other patients. In the bone marrow is the same way, a bone marrow or the stem cell from one donor is transferred to the patient. However, it does not require any kind of surgery, it is just the simple transfusion. So now we will go to steps and procedures which are involved in the bone marrow or stem cell transplant. So first and foremost, we have to find out what kind of transplant or bone marrow transplant you need. Broadly, there are two types of transplant. One is called autologous transplant and the second is allogenic transplant. So in autologous transplant, we take the patient's own stem cells before treatment and then use that stem cell for the recovery of the patients. So it is same blood or same stem cells. While in allogenic transplant, we use another donor to donate their blood cells or the stem cells which are infused to the patients and then patient gets recovered from his disease. So this is the first step. According to your disease, your doctor will decide whether you should go for autologous or allogenic transplant. Once this has been decided, for allogenic transplant, we need to find out a donor. Now, how you select the donor? The donor selection process requires matching of the patient and the donor, a genetic matching which in our language we called is at a HLA matching. It is 20 to 30% chance that if you have a brother or the sister, he has the same HLA as like yours. As long as the HLA is matched, even the blood group is different or the donor may be male or female can be considered as a donor. If your brother or sister does not have the matching HLA or you don't have a brother or sister, then what we can do for you? So in that case, there are so many donor registries available worldwide. So these are the registries where the voluntary bone marrow donors have registered their name and their HLA has been already done and kept in the registry. So if any patient requires a donor, then his HLA is sent to that registry. Through their computer database, they go through all the available donors and their HLA list and find out if anyone has matching donor or not. It may be possible that your matching might be anywhere in the India or even outside in the India. And from there, we do several procedures on that donor and then the cells can be procured to the transplant center. Now the procedure which are involved for the cell collection is also important because many a times donor are worried whether they will get any problem or not in the future. So I will say donor will not get any problem by donating their bone marrow or stem cell. Nowadays the procedure is very simple. The stem cells are collected simply from the blood, just like you are donating the blood. There is a machine like the dialysis machine. Your blood from your one vein go to the machine. Machine will collect the stem cells and the remaining blood is given back again to the donor itself. This process around take 4 to 5 hours and around 200 or 300 ml of the blood is collected. Right? So this is the way it works. Donor can be immediately discharged and can do all kinds of work immediately after discharge. So as such, there is no problem with the donor. Please keep this in mind. Now once you have selected the donor, cells are collected, what is the next procedure? So the next procedure is to admit the patient in specialized bone marrow transplant unit. So these are the isolated units which are specially designed so that even the air is filtered, the water which comes here is also filtered. All the doctors and nurses who came in that room has to take all the sterile precaution as much as possible to decrease the chance of infection. Once patient is get admitted, we usually give the chemotherapy. The chemotherapy is beyond that which is given normally to the patients of cancer. It is considered as a high dose chemotherapy. So when this chemotherapy is given, it destroys all the available cells in the body, including all the stem cells of the patient. So patient's count will gradually fall down near to the zero. After this chemotherapy, we give this, transfuse these collected stem cells to the patient just like a simple blood transfusion. Usually it will take around an hour for transfusion. If the patient has already preserved the cells, which might be in amount of more than 200, 300 or 400, then you might give it on 2 different days. Now once you have given the stem cells in the blood, they flow in the blood, they goes into the bone marrow and get seated or get adjusted in the area in the bone marrow where the patient's original stem cell were residing, which already has been destroyed. Now in that place they reside there, gradually they start working, and once they start working, patient's blood cells again start increasing, his WBC start rising, platelet count start rising, hemoglobin start rising. This period usually takes 2 to 3 weeks for the cells to start its complete function. Once the count is recovered, patient does not require any transfusion and it does not have any problem, we discharge the patient. During these 2 or 3 weeks where the counts are low, patient's immunity is considered very low, and during this period there is higher chances of infections, fever and all this kind of problems. Once the patient has recovered and patient is discharged, patient is regularly followed up. For allogenic transplant, there is one more element is there. Because the donor cells are different from the patient's own cells, there is always a some degree of fighting between the donor cells and patient's own body. When this fighting is exaggerated, there might be some damage to the patient's own body, which in our term is termed as a GVHD or graft versus host disease. To decrease the chances of such event, we usually give some tablets and injections to the patient during the transplant and post-transplant for 6 to 12 months, which is termed as a immunosuppressive therapy, which decreases the activity of donor cells and prevent the patient's body's damage. Right? So this is in a nutshell a process which is involved in the bone marrow transplant or stem cell transplant. For more details, I think better you consult with your doctor or transplant physician, because not two patients or not two transplants are identical. There are many factors like patient's age, his disease, his previous treatment, his other problems, similarly donor's age. All these factors take into consideration and the outcome may vary depending on the different factors. If you have any other questions or comments that you want to pass on me, or you want to share your opinions, you can note down my email ID, which will be the drsanket2086 drsanket2086 and on my Twitter, which is drsanket2086. Thank you.